Dr. Nardi here, back with another video, and in this video I would like to talk about dementia, and this is basically a family of diseases that causes serious impairment to behavioral and cognitive functioning. Now, I started thinking about this topic actually after watching a very, I would say, famous Twitch/YouTuber, Kitboga. Now, I will put a link down below if you've never seen this YouTuber/Twitch streamer. I will also play a very brief clip of Kitboga in action. But what this streamer does is he tries to raise awareness through educating everybody about the scams and how they take advantage of individuals with dementia, and how scammers sometimes take advantage of elderly people, especially who might be suffering from some kind of cognitive impairment.
Listen to me, please. Listen
Okay,
to
so
me,
I
please,
don't know if
please,
you see it,
please,
but I
please
think
listen to
on the
me.
back of the
Please
card
listen
it
to
was
me.
just saying that
Please listen to
you can
me.
get cash
Ma'am,
out of it
listen to me.
on the Google
Ma'am,
store.
listen to
So I
me.
went to the
Ma'am,
Google
ma'am.
store.
Whoa, wait. Ma'am, no. No, 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 no. 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 You don't have to do that. Ma'am, you don't have to do that.
Now, as ridiculous or silly as some of these situations are that he puts the scammers in, he is actually raising awareness, I think, for underlying issue, especially for those individuals who are suffering from some kind of cognitive impairment. But he also mentions during his stream that he was inspired to make a lot of his videos and start what they call scam baiting, where you call people and pretend to be an old person with dementia, because his family members suffered from dementia, and it affects a lot of people. So I thought I should make a video to educate everybody a little bit about this topic, and if it inspires you, I hope you go on to learn a little bit more about this topic. So if you have not done so so far, please like, subscribe, and share this video. Let's get started. Now, as I was mentioning earlier, dementia is a family of diseases involving serious impairment of behavioral and cognitive functioning. Alzheimer's disease is the most common, and this disease affects everybody at all socio and economic levels. It affects, doesn't matter your ethnicity or your racial group, it affects everybody. And approximately half of all people 85 years of age and older have Alzheimer's disease, which is very high, especially with our aging population. So you might be asking yourself, what are the symptoms of Alzheimer's disease? Well, there's a gradual decline in memory, attention, and judgment. There's often confusion as to time and place. There could be difficulties communicating. There is decline in self-care skills. Sometimes you will see inappropriate behavior. You might notice personality changes. And you also might see loss of bladder control. This is more so at the end stages of Alzheimer's. Now, rates of deterioration, now that varies from person to person, but we could look at an average, and that's usually around 12 years from the onset of the symptoms. The only way you could be 100% certain about your diagnosis is through a brain autopsy after the time of death. And really, they go into the brain and they document the number of amyloid plaques and neurofibrary tangles. So you might be asking yourself, what causes Alzheimer's disease? Well, early onset, and that's before age 60, tends to run in families. So there is a genetic component to it. What we call it is an autosomal dominant inheritance. And this is the presence of a certain gene that there is a 100% chance of a person eventually getting the disease. So we can actually see it running in families. And then the later onset, after 60, it may be linked to genetic other risk factors that we haven't fully identified. And they also kind of are looking at these amyloid plaque formations. And the way they kind of get at all this is through neuroimaging. Unfortunately, there is no cure or preventative measures for Alzheimer's disease. There are, again, very few medications, and the ones that do, some maybe show some promising results, but unfortunately more research needs to be done. Now, the other important facet is behavioral and educational interventions, and there are ways to work with these individuals to help patients learn names of new people. Again, though, there's things that the person suffering from these has to learn in order to kind of learn names of new people. And interestingly enough, some programs actually bring preschoolers and older adults together to learn together. And there seems to be some promising results there as well. You might have also heard of Parkinson's disease. This is a brain disease known for its characteristic motor symptoms. There's you might see very slow walking, difficulty in getting in and out of chairs, and you might actually see a slow hand tremor. Now, this is caused by a decrease of dopamine, and dopamine's involved with pretty much all movement. Medications and surgery can cause a deterioration of neurons that release dopamine, but more research needs to be done. We don't really understand the underlying cause of Parkinson's disease, but we do know that maybe some medications that act upon dopamine receptors could be helpful for those suffering from it, but there is no cure for Parkinson's. There's also one other form of dementia I want to mention. It's called chronic trauma encephaly, CTE. And this is caused by repeated head trauma, such as concussions. And again, this occurs as a result of repeated brain trauma in sports or military combat. So you might hear about the NFL pushing to reduce CTE with their players. And I think they're introducing some kind of specialized helmets that they could wear, specialized paddings. And you could even see here on the screen that 14 of the 15 brain scans of former NFL players showed evidence of CTE. So it is very, unfortunately, common due to the nature of the game and how tackles and plays are made. Well, I hope you learned something new after watching this video, and maybe you'll have a little more compassion or understanding for individuals who have some kind of cognitive decline and might become victims of somebody taking advantage of them. And again, I hope I educated you all a little bit. If you have not done so, please like, subscribe, and share. With that said, I'll see you all in the next video. Take care. Bye for now.